7 possible reasons why you're coughing. Feel like you've been coughing forever? The truth is, the average cough lasts 18 days. What the what? And while it's the season for passing germs, there's lots of other reasons you could be hacking up a lung. Ahead, your 101 class on distinguishing between the most common types of coughs and how long they generally last. 1. The common cold or flu, 1 to 2 weeks. If you're dealing with a wet cough, in addition to symptoms like a runny nose, sore throat, headache, sneezing, or fever, can you hear the nasal medication commercial playing in your head yet? Odds are you've picked up one of winter's 2 favorite bugs, the cold or flu, says Catherine Nielakakis, MD, a pulmonologist at the Cleveland Clinic. You'll see a slew of combo cough and cold meds on the pharmacy shelf with different cough suppressants or expectorants to clear or quiet your lungs, but check with your pharmacist before medicating with one of those heavy hitters. It's safer to treat symptoms one by one to reduce your risk of drug interactions, and you should only use a cough suppressant at night if you're missing out on sleep, since clearing the lungs is usually a good thing. 2. Bronchitis, a few days to a few weeks. It's the barky, hacking cough that quickly turns you into office enemy numero uno. Bronchitis, an inflammation of the bronchial tubes, often starts out as a mild cold and then develops into that nasty, sometimes painful, wet cough that won't quit, and brings up lovely phlegm in shades of brown, green, and yellow. Treatment is usually rest and warm fluids to break up the mucus clinging to your lungs or an inhaler to help open your airways. If the bronchitis is caused by a bacterial infection, you'll need antibiotics to clear things up, says Nielakakis. 3. Pneumonia, a few weeks to a month. When the air sacs in your lungs become infected, either because of a virus, bacteria, or fungi, you may be sidelined with mild to severe symptoms including a phlegmy or dry cough, fever, and shortness of breath. Other trademark signs: coughing up discolored mucus from your lungs and having zero energy, says Nielakakis. Older adults or young kids may need a hospital stay for medical attention. A chest X-ray is usually ordered to diagnose the infection, and a course of antibiotics, if it's bacterial, can clear the bugs and cough out of your lungs. 4. Post-nasal drip, chronic. People with PND can usually feel mucus from their sinuses sliding down the back of their throat, which triggers a wet cough, typically at night, when you're kicked back, and a nauseous stomach in the AM from the bugal flow. For some people, it's obvious this is happening, and they have other allergy symptoms like sneezing or an itchy nose, while others only show more subtle signs, says Nielakakis. Antihistamines or a nasal steroid, both available OTC, can help clear the sinuses, and it's a good idea to turn on a humidifier at night, especially in the winter, since dryness can exacerbate the problem. 5. Asthma, chronic. When the airways narrow and swell, breathing becomes tough, think, wheezing and chest tightness, and a dry cough can come out. Your lungs have better airflow during the daytime and late afternoon, so this kind of a cough typically happens at night or in the morning, says Nielakakis. Docs typically diagnose asthma through breathing or lung function tests and use inhaled steroids or a drug called albuterol to prevent and treat symptoms. 6. Gastroesophageal reflux disease, chronic. Acids that travel from your stomach back up to the esophagus, heartburn, may also trigger a dry cough. It'll usually come out after eating a big meal or in the mornings and evenings when you're lying down and acid can flow more freely. A select few people can actually develop the cough without any other obvious heartburn symptoms, which can make it tricky to diagnose unless a doc sends a camera down your throat. If you or your MD think GERD could be behind all that throat clearing and hacking, tweaking your eating habits, that is limiting fatty or spicy foods, booze, and caffeine, can help, as well as acid reflux meds. 7. Less likely, COPD, lung cancer or chronic heart disease. If you've got a super stubborn cough that's not responding to treatment, we're talking 2 to 3 months or longer, it's a good idea to see your doctor rule out some of the more rare, scary causes of chronic hacking like COPD, chronic obstructive pulmonary disorder, usually caused by smoking or other inhaled irritants, lung cancer, or even heart problems. Women, especially, don't think as much about cardiac problems, so if you have a family history of heart disease or you've got other risk factors like high blood pressure, you definitely want to see a doctor, says Neil Akakis.